Hi, welcome back to ParentingU. I'm Stephanie, and today we are joined by Dr. Melissa Holland and Dr. Katie Queen, and we're going to talk all things childhood obesity. September is Childhood Obesity Month, and it's an important topic for us all, so I'm really glad you both are here today. Welcome.
Thank you for having us.
Yeah, thank you. Okay, so Dr. Queen, I want you to introduce yourself, tell us a little bit about what you do with our health system.
Sure. So I'm Dr. Katie Queen. I am a general pediatrician by training. I also have a board certification in obesity, which allows me to take care of the more severe cases of children with obesity in our state. And I also work for Our Lady of the Lake at the Children's Hospital, which is here where we're recording on the fourth floor, mostly on Fridays. And we do a clinic for children with obesity, and it's a multidisciplinary clinic. Dr. Holland joins me on some Fridays, and we have two dietitians and a social worker. So we have a whole team approach to helping kids with weight management. I also serve as a pediatrician at Our Lady of the Angels, which is one of our sister hospitals
You
in
wear
Bogalusa.
many hats, but yes, the weight nutrition clinic, that's an important piece of our offerings here. And Dr. Holland, what about you?
Yes, so I also work for Our Lady of the Lake Children's Health, but I actually work in Baton Rouge. I'm a general pediatrician, board certified. I am not obesity certified like Dr. Queen here,
But she's going to be.
but eventually I would love to be. And I really enjoy working with kids who struggle with obesity, and that's why I started to or I joined the clinic with Dr. Queen.
Great. Well, thank you so much for being here. Like I said, September, and y'all know this, is Childhood Obesity Month. And as a health system, childhood obesity is an advocacy platform for us, in that we really believe we can change the future of Louisiana by changing the health of its kids. And obesity being one of those areas where we can make real change if we understand it, and if we focus on it, and if we make waves to impact it. So, a stat I heard: 1 in 7 children ages 10 to 17 are obese. And that's according to the National Survey of Children's Health. Talk to me about that statistic. What does it mean for children who are obese? How does that come about? And what is the work you're doing to really advance the health and education to change that statistic?
So, yeah, that statistic is from the most recent data from 2020 up to 2020, 1 in 7. But what I want to point out is that Louisiana, unfortunately, is higher than that
Mm.
statistic. And so we are the third highest rate of childhood obesity in the country. And so what we envisioned is that Our Lady of the Lake Children's Health would sort of stand up to the charge of making this better. And so what we did is we created a center for weight and nutrition. And the idea is to provide care for those patients with obesity, but not just that. There's a bigger picture, like you said, the advocacy. And so what we've really tried to do is build a network of pediatricians. We'll talk about that in a little while, a network of pediatricians who understand that obesity is a disease, that it's not just a number on the scale. It's a disease of the metabolism. And we have trained those pediatricians. We've also started to reach out to the community. We have partnerships now with LSU Ag Center. We are working on an adolescent program that teenagers in the Baton Rouge area can go and learn about nutrition and cooking and physical activity, and some national organizations such as the National Diabetes Association to offer some programs in the community. So families should be able to not just see their pediatrician for their weight, not just maybe get referred to our clinic, but also be able to seek out more education, more learning in the community in programs such as this. And then the bigger picture is that we are trying to advocate at the state level for the state to really make this an emphasis. And we are working with payers to get better access to medication, because that's always a big problem.
And by payers, you mean insurance companies.
Insurance companies. So the point is that we are doing a lot. We're partnering with Pennington on some research studies. We are trying to really get the momentum going in our state so that we can fix that statistic.
You mentioned that obesity is a disease of the metabolism. Tell me more about that, because I don't know if a lot of parents understand exactly what that means.
Yes, that's the great question. And we wanted to dispel the myth. There's a lot of stigma and a lot of bias around weight in general, even the word obesity.
Mhm.
I think that we as pediatricians are sort of afraid to say it. But when the body has extra fat cells that build up in the body, it not only pushes on vital organs, for example, in the liver, it may push out the healthy cells. The fat cells may push out the healthy cells. But what people don't realize is the fat cells themselves actually secrete hormones. There's a lot of hormones that fat cells secrete, and then that affects your metabolism. Not only that, there's this lot of complex, very complex, and this is part of when I got trained as for board certification. It's very complex. The signals between your brain and your stomach, ooh, it's complicated.
Mhm.
And so you're signaling for feeling full and feeling hungry. For most people, it's working fine. But for kids that when that extra fat builds up and those cells are secreting extra hormone, it actually ends up affecting the signaling. And so it's almost like a thermostat that's not working. And these kids are really, truly hungry. They really, truly don't feel full after they eat.
Mhm.
And so when we talk about, oh, well, you just need to eat healthier
Mhm.
and you need to try to just be more active, it's not that easy. It's not that simple. It actually, the disease itself is sort of something that we have to address, just like we would for a kid with hypertension, high blood pressure, just like we would for a kid with diabetes. We have to think of it as a disease in itself. And that's what we try to do in our clinic.
I think that's so interesting, and you're right that there's that stigma, because a lot of people will say, "Oh, they're just lazy," or, "Oh, they just don't want to change," whatever that is, and looking at it as a medical approach, and especially for the children who are still learning what society is saying about them, I think is so incredible. Dr. Holland, tell me a little bit about how a patient might come to the Weight and Nutrition Center. What are the needs that they might have, or how parents can maybe be aware of when they might need to ask their pediatrician for some help?
Sure. So, I think first and foremost, starting with your pediatrician or your provider is important because they're going to be the ones who can guide you if they really do need to go to the weight and nutrition clinic, or if maybe you can start with some lifestyle changes at home, like with the guidance of your pediatrician. So I think first and foremost, going there and asking the questions, is my child um overweight, or we like to call it, does my child have excess weight? We
Mhm.
try to limit the term obesity actually in the clinic because it does have a stigma to it, and we're trying to work with that with the patients, with our families here. So, I think asking your pediatrician, are they even healthy? Are they even at the appropriate weight is important first. And then if they're at a point, like Dr. Queen was saying, where I've tried to eat healthy, I've tried to exercise, and I'm still not losing weight, I'm actually gaining weight, or it's just not coming off, that's when I would say parents need to ask, "Hey, is there somewhere else we could go to get evaluated for this weight?"
Mhm.
And that's where the weight nutrition clinic come in with Dr. Queen and I.
And we get referrals from all over the state, mostly Baton Rouge area, but we have gotten them as far as Monroe.
Yeah.
And so any pediatrician can refer to us. We have a website we'll put in the show notes, and anybody can reach out to our clinic if you're just interested. You can also self-refer. It doesn't have to be, we will eventually track down the official referral, but parents can call and ask questions as well.
Mhm. Well, tell me a little bit about some of the approaches you take in the clinic as you meet a patient and you kind of talk through what are some of the areas you talk about, or some of the ways that you may treat some of the pieces that surround this disease.
So, the first visit we have with one of the medical providers, which is myself and Dr. Holland, and it we spend 45 minutes to an hour really delving into sort of their weight trajectory. Did their weight start to increase at a young age? And if so, we may consider some genetic testing. We actually have some saliva genetic testing to see if there's a genetic cause of that weight gain. We sort of delve into mental health, especially in our teenagers. Is there emotional eating? Is there craving for food? We talk about what is the family structure like? Are there social stressors? We do screen for things like food insecurity, which means, does your family have enough food? Can we afford the food, the healthy food? So we go from all different areas. Of course, delve into nutrition. We ask about eating habits. We ask about drinking habits. We ask about physical activity, but it really delves into the deeper issue of what might be the cause. And every single family, it surprises me to this day, has a different reason. And so what we do is we gather all that information. We look at lab work. We look at what is the disease actually causing at this time. Does the patient have high blood pressure? Do they have signs of prediabetes? Do they have signs of high cholesterol? And then we tailor our treatment to what they need. So that might just be lifestyle treatment, which is let's talk about being healthier. Let's make changes. Let's make goals. We do a lot of goal setting. We have little prizes for when the kids make goals. It's a family approach. We really emphasize that the whole family, we want grandma to come, we want aunt to come, we want everyone to come to these visits. And then I think what's important to realize is sometimes just seeing our dietitian or just seeing our behaviorist, which is a social worker, it might not be enough. So we can try that 3 to 6 months of seeing us maybe monthly, but then sometimes we need to offer medication. And so yes, we do prescribe weight loss or anti-obesity medication starting at age 12. There are some special situations where we go younger than age 12, but this is something that's been approved and it's been shown to affect the actual disease of obesity. And then I have some kids, not many, but some kids who even the medicine and the lifestyle change is still not enough. And sometimes we have to consider referrals for bariatric surgery. And we are working with Pennington currently to try to develop an adolescent bariatric surgery program.
Well, that's really great that it's not a one size fits all. It's not one approach. It's you're talking to the patient, you're listening to what is going on in their life, and you're creating a plan that works for them.
Exactly. And we also offer virtual visits. So sometimes families can't get to us at the Children's Hospital. Sometimes they just come for 1 or 2 visits and then that's enough. And then they go out into the world and do their own thing. Sometimes we work with them for 3, 6. I have one patient who's now been with us for a year. We're celebrating our 1 year anniversary today. And so that's, sort of what we do in the clinic. And Dr. Holland has really stepped up. She's a general pediatrician, and because she has this interest, she's sort of there to support. And we're looking at things from a primary care perspective as well. We're not just specialists; we're pediatricians as well, and so we're looking at things from all aspects.
Yeah, yeah, absolutely. I mean, just to add to that, there's some patients who they'll come to the clinic and they've lost contact with their own pediatrician. They've been self-referred. And so, I tried to help guide them back, like, hey, you need to follow up with your pediatrician about this or that. And just like Dr. Queen said, head to toe is really what we look at in the clinic. It's not just about obesity. Obesity, um, fascinating yet also very unfortunate. It affects every system in your body, and so we address every system in the body. And then if patients or if kids have been lost to follow up to their pediatrician, for let's say they have knee problems and yeah, I've been having this knee problem, they also have excess weight, you try to do whatever treatment you can for them, but also, hey, if this isn't getting better, I would follow up with your pediatrician. So I think that's also, yeah, where it kind of ties
We get a
into
lot of
that.
referrals from specialists as well.
Hmm.
And so I think actually most of our referrals are from specialists. So let's say your child maybe has been referred to the pulmonologist because they're snoring or because their asthma is acting up. Then sometimes the root cause is their weight. And so they'll refer to us and things like that.
To address it. Got it. So as parents, we often are greeted with lots of questions from kids, or they come home from school, or just different activities. And I'm just curious, how do we talk to them about weight? Like if they start to comment on themselves, or maybe someone has commented to them, or if they see something at school, maybe some kids are making fun of somebody. How do we approach that subject with grace and understanding for what is going on?
So it's hard. I mean, I have 3 children myself, and they come home or, and they talk about kids at their school maybe that they noticed were bigger than them. And we have a rule in our house, we don't say the FAT word. We sort of joke about it lightheartedly, but you can call animals that, but not kids that. But I think it's important to talk about how their kids come in all shapes and sizes, and that it's not necessarily just the kid's choice. It's not even necessarily the parents' fault. It's that we all have different genetics that we're born with, and I teach my kids what that means. We have different situations that we're born into, and so I think just teaching non-judgment and teaching that we should embrace all different shapes and sizes, and that child and their family, they have their own journey. And so I think just talking to your kids about trying not to say anything about the other kids if they have an extra weight or they're larger. Uh, in making sure that we're talking about bullying. And if your child is being bullied about their weight, it's okay to bring that to the teacher, to the principal. And then it would probably be important to talk to the child that if your child does suffer with their weight, it's not about the weight, it's not about the number, it's about health. And I think that's our focus of our clinic is that we're not a weight loss clinic. We are really trying to emphasize that we want kids to be the healthiest version that they can possibly be.
Yeah.
And that might not be a normal weight. That might not be a normal BMI, but it's going to be the healthiest version of themselves so that they don't grow up and have diseases as adults, so that they can live a happy, healthy life. And I think health is really the focus rather than weight.
Yes, yeah, I definitely agree. And I think to add to it, you know, telling your kids even from a young age, love your body in every state it's in because you're going to be with your body for the rest of your life. And so, it may not be perfect, it will never be perfect, but you need to appreciate it for what it is. Even like, during the weight loss journey. That's a big topic I think that you have to instill in children and really anyone, I think adults too. But like, trying to understand that it's a journey and things change, but you know,
And building self-confidence. I do that with my own kids
yeah.
and talk about what's one thing you love about yourself and doing that daily and really trying to build on their strengths of the child.
Mhm.
Well, so speaking of health, maybe what are some tips about parents can use to find healthy food or choosing good activity? What are some ways that our families at home can introduce or continue those healthy habits?
Yeah, so I think for starters, in terms of nutrition, taking your children to the grocery store with you. I know that's probably hectic depending how many
Dr.
kids
Holland
you
doesn't
have.
have children, but that's not an
I don't.
I say that with a grain of salt, but ideally, or maybe making pre-planning your meals with your kids,
Yeah.
letting them pick out a meal. I think that might be more fair and realistic. But pre-planning your meals and then going to the store and shopping the perimeter of the store is ideal because everything on the perimeter is really healthier for you. Meats, fresh fruit and vegetables, dairy, that kind of stuff. So that is kind of where you should really focus more of your ingredients.
So engaging, I think engaging your children, when you say bring your children to the grocery, I think what we're getting at is that we want the kids to pick out a recipe, get excited about food. I mean, food is amazing. We all, that's probably one of the reasons I do this subject, but it's fun to cook. So take your kids with them, let them pick out something. My kids will go and pick out a dragon fruit and I'm like,
It
I don't
looks
know how to cut
crazy.
that, but we'll buy it and we'll cut it up and look it up on YouTube. And I heard there's a dragon fruit on TikTok. All the kids on TikTok know about dragon fruit. Look it up. I don't know. But yeah, so get your kids excited about a fruit or a vegetable or a food that's healthier, and then cook it with them and teach them about nutrition and eating healthy. Let them be in the kitchen. Let them get messy and take them to the grocery if you can.
It can.
Do you talk to kids about, or would you recommend saying there are good foods, there are bad foods, or are there other words we can use to talk about food to make it less polar and
hmm
black and white? Like,
Mhm.
how do we do that?
100%. We do not recommend saying this is a good food or a bad food. We don't want to put judgment on the food. So, ice cream, it's not a bad food. I love ice cream. I eat ice cream, but we just can't have it all the time.
Mhm.
If we have just teaching boundaries around the moderation, talking about we just have to be careful that putting too much of this food in our body might make our body unhealthy. And so using the words healthy or unhealthy, talking about just we can't have too much, I think that's how the way parents should kind of approach it. Nowadays, we all know that kids are in front of the screen a lot, even my own kids. And while the national recommendation is no screen time till 18 months,
Mhm.
hard to do. And after that, there's limits of about an hour. And then after that, there's really not a set limit other than we should really have limits. We shouldn't just let our kids go on TikTok or YouTube as long as they want. We should have some limits around it. And so I think focusing on reducing screen time so that it doesn't affect their sleep, so that it doesn't affect their mood, we have studies that are showing that things like Instagram and social media is increasing teenage anxiety. So we need to have some structure and limits, the same thing, moderation around screen time. But if your kids are at home and let's say you don't belong to a gym, or let's say you don't belong to a sports team where your kids can be active, you can do physical activity with your kids at home on YouTube. So I say that because screen time isn't necessarily a bad thing. You can actually go on YouTube and type in physical activity, and there's 1,000 different programs, and we can put a couple that we recommend in the show notes. But there's lots you can do at home in your own house.
We actually have a series on the Children's Health YouTube that is Adrian, our health educator, does 5-minute fit breaks. So we can link a couple of those where he'll do 5 minutes of activity and he'll just show you the moves. It's a lot of cardio, kind of kickboxing,
Mhm.
so fun and engaging. So we'll definitely link that. Doesn't have to be hard, is what we're
Yes, and it
getting
could be
at.
in small increments
Mhm.
during commercials or during a quick break while they're doing their homework.
Mhm.
5, 10 minutes is all you need, and then it adds up over the day.
And also to add to that, modeling that, doing it with your children is also really helpful because it's showing them like, "Hey, mom and dad also do this, so I should do this."
More is caught than taught, right?
Mhm.
I like that.
You mentioned you have a lot of partners, both on the community level, state level, national level. You mentioned a partnership with Pennington, and there's a program called Team Up. Tell me about that.
Yes, so Team Up is a research program in the state of Louisiana. Our Lady of the Lake is a part of it. It's actually in multiple states, but it's a research study that the lake is partnering with Pennington Biomedical Research Center, where we are trying to form a program to help children lose weight and live a healthier lifestyle, essentially. And so it is a research study, but I like to call it a program essentially because I'm actually one of the providers who does, along with Dr. Queen, who do the team up visits with our patients. But right now we have, I believe, 130 patients signed up, families signed up, and we have over, or no, actually 25 providers who have been trained from the American Academy of Pediatrics in obesity care, specialized. They're not board certified like Dr. Queen
Sure.
here, but they are specialized. They do a little extra training to handle these cases. And then we also have 5, they're called FBT coaches, which is family based training or treatment coaches. They're like dietitians and social workers who assist the families as well. And so it's been successful research program so far. I would say it's ongoing. And yeah.
So it's ongoing for the families, those 130 families. However, the enrollment is coming to an end. And so
Okay.
you can no longer enroll your child, but we'll have to give you an update when we get the result
Yeah.
of Team Up. What we're really looking at with Pennington is we're looking at what intensity is needed to help a child with obesity
Mhm.
to improve their health. So we're looking at just seeing your pediatrician monthly. That's one intensity, and that might be about 12 to 15 visits in a year, versus seeing a coach weekly. And if you're seeing a coach weekly for 30 to 50 visits in a year, if that's more effective, then we need to put our resources in community health coaches and trying to build up that sort of community intensive program versus just taking care of kids in the medical home.
So it could truly change the trajectory of the kid's health if we understand what it takes.
Understand the dose
Mhm.
of lifestyle treatment and care.
Very cool. Very cool. Is there anything else you would like our parents to know about weight, about obesity, about the work you're doing, or about what they can do just to really support their kids?
I think it's overwhelming. If your child does struggle with weight issues, and it may not be to the point of obesity. It may just be you notice your child's gaining weight. After COVID, The studies are showing, especially our school age kids, those kids that are about, ages 9 to 11, they gained weight at a faster rate than before COVID. There's lots of reasons for that. But if your child might be one of those that you've noticed they're having to get bigger clothes quicker than you were expecting, um, start with 1 or 2 goals. Sit down as a family. Think about what's 1 or 2 things you can do. And we try with our patients every visit to have them make 1 or 2 goals. It could be a nutrition goal. It could be a physical activity goal. It could be a sleep goal. It doesn't have to be specific to nutrition. But what can you guys do and how are you going to measure that? We try not to make general goals. We try to say, oh, let's not just say we're going to be healthier. So for example, we might start with, my favorite goal is to start with drinks. So maybe our family is going to cut down on the amount of sugar sweetened beverages that we're drinking, whether that's soda or sweet tea or Gatorade or Kool-Aid or juice. Juice has a lot more sugar than people realize. So maybe our child is drinking 5 or more cups. Maybe we're not going to say, let's stop that because that might be sort of restrictive to the child, right? Maybe we're just going to say, let's cut down
Yeah.
to half. Let's only have 3 a day. So that family can sit down and come up with a game plan with the child that's maybe not going to be super restrictive. That's going to, we really focus on making the child the center, making the child excited, having the child choose the goal. We don't choose the goal for them. We try to have the child choose the goal and then direct us in how we can support that goal.
And it gives them a little bit more ownership.
Empowers them.
Mhm. It's also important to remember if, obesity is a disease, and if we are still struggling with weight even after these lifestyle changes, we have resources here. We're here to help.
Exactly. So you should reach out to your pediatrician who can then reach out to us. You don't have to do it alone, is I think the message. And so if you're struggling and you have been trying to work on healthier choices with your child and your family and you're not seeing the results, then reach out to your primary care provider and we can kind of help walk you along. We also have some great dietitians for Our Lady of the Lake Children's Health who see patients as well on their own outside of our clinic. And you can also get a referral to them as well.
Tell me a little bit about the Weight and Nutrition Center. So, it's a statewide program. It's part of our children's health advocacy platform where we really are talking through and thinking about and focusing on obesity. Tell us what happens there. What is your approach, and what do you guys do there?
So when we were naming it, we purposely did not name it the obesity clinic. We wanted to kind of stay away from the stigma of the word obesity. So we called it the Weight and Nutrition Center. So we are more than just a clinic. While we do have a physical clinic on the 4th floor of the Children's Hospital in Baton Rouge, we also sort of envision ourselves as a statewide network of pediatricians and specialists who work together to help any child in the state of Louisiana with weight. We have virtual visits. We are working on creating some satellite in person clinics, but we can see kids from anywhere in the entire state. We have 2 dietitians, and we're going to be growing. We have a social worker who does our behavioral modification and anything related to mental and social emotional health. And then we have ourselves 2 pediatricians, and we also are hoping to grow as well in our provider availability.
This has been so interesting, and I know a lot of our parents may want to know more. So, how can they connect with you or learn more about what you're offering?
So I think just in general, healthychildren.org is one of my favorite websites as a parent because it's really good evidence-based information. There's so much on there about nutrition and physical activity and sleep and healthy habits for your family. So that's a good place to start. But if you want to specifically reach out to us, we have a website is OLOL children's.org backslash nutrition. We'll put it in the show notes. It's a hard to say. And then we have a phone number 1-833-374-HEAL if you want to reach out to our Weight and Nutrition Center. You can also reach out to one of our pediatricians in our network, which is all over the state of Louisiana.
Well, thank you both so much. I loved having you here, and thank you for tuning in to Parenting You. We are with you every step of the way on this journey we call parenting. We'll see you next time.